So I have been asked by many what it's like to work out or to have an exercise routine while also dealing with lupus and fibromyalgia. Not a lot of you may know what lupus is. You probably have heard of fibromyalgia kind of floating around, being, a lot of doctors kind of say that it's in your mind or that the patient is upplaying their symptoms, but it revolves around a lot of joint pain, um, pretty much pain, period. Now, lupus is similar in a way. I actually have SLE, one form of lupus, and it is actually a chronic inflammatory connective tissue disease. It can affect pretty much any of my organs in my body. It also happens to a lot of women in their, I guess you can say, like childbearing age. So at age that they can have children, it usually manifest, or usually you get diagnosed with it around then. There is no cure, but there is a lot of treatments to reduce the symptoms. So what are the symptoms? So I have a whole list I'm actually going to go over here. Symptoms are joint pain, joint stiffness, muscle fatigue, fatigue period. It could cause even chronic fatigue. It's actually, it causes a lot of people actually to stop working out, stop being active. And for the longest time, I kept thinking, I can't do this. I can't do these high intensity interval workouts. I can't do these jump squats. I can't do this or I can't do that. I had it in my mind of I can't because of my joints. My joints ached all the time. My muscles hurt all the time. And I actually did not go to my doctor to ask if I can work out. I started out easy. So what did I do? I did planks. I did push-ups on my knees. I did sit-ups. I did all sorts of versions of a sit-up or a crunch. I did planks on my elbows. I modified it. So I started out simple. Nothing too high intense. I even have a fitness board on Pinterest, and I was specifically looking up low intensity workouts for that main purpose, because I was like, I can't do high intensity. That's not for me. I can't do that. But so I started those small, low impact workouts. In April, I went for 2 weeks and did that. And the squats alone were extremely painful on my knees. And I could feel it in my lower back, and then I realized that maybe my form wasn't right. And I kept going and kept watching my form, and my back felt better, but my knees did not. So then what I did is I took a little break for a little bit. I decided to focus more on my eating habits and got back at it. And this time I did a 30-day workout challenge, and I did modify a lot. I am now on, I think, 6 months into this, and so far I do still have joint stiffness. That has not changed. I still get muscle aches and muscle fatigue. That has not changed. But what has changed is the range of motion and the reduced joint stiffness. So my joints aren't as stiff as much anymore. I have more range of motion because I've, worked out those muscles. It has strengthened, I feel like it strengthened a lot of muscles. I mean, I've toned up a lot, and I'm able to do certain workouts or exercises that I was not able to do in the first couple weeks. What exercising can do for lupus patients is actually, it helps you maintain strong bones so that way you don't get osteoarthritis, osteoporosis, which is often also caused not just by lupus, but also by the medication that you're taking for this illness. Because, you're prescribed a lot of anti-inflammatory type medications. It also helps with cardiac health. So not only are you improving your muscle tone, your bone strengthening, but also all that muscle around your heart. And that way it reduces the chance of any cardiac arrest or cardiac issues later on down the road. And because you are working out, also you are staying fit, toning up, and possibly losing weight. Now, when you're gaining weight, because you're not working out, you put all that fat pretty much on your muscles and on your bones, which causes a lot of pain. I know just from being pregnant, technically, I guess you can consider that overweight, but I was pregnant. So all that extra weight on your body, it hurts. So of course, with working out, you're going to lose that weight and you're going to tone up. So again, strengthening your bones and strengthening your muscles. So that way you don't have all that stress on your joints pretty much. Also with working out, you will possibly have improved sleep patterns. I have 3 kids. I have a 10-month-old baby. I also decided to be crazy, and now I have an 8-week-old puppy. Sleep, what's that? I am sleeping better, though. For the longest time, it would take me hours to get to sleep. So much so that I felt like I almost needed to discuss with the doctor about getting sleep medication to help me sleep. It didn't matter how worn out I was. It didn't matter how much sleep I had the night before. If I got like 2 hours the night before and I was really exhausted, I still couldn't sleep. But with working out, I feel like I'm actually falling asleep faster and longer. And I feel like I'm actually getting into that REM deep sleep because I am actually having dreams. Not all that I can remember, but I am having dreams. So I am sleeping better. So that is a plus. And I feel more, what's the word? Not really more awake, but more aware, more, not really enthusiastic, but I don't really know the word I'm looking for. But I wake up in the morning feeling refreshed, pretty much. I guess you could say that. I can wake up at 6:30 in the morning to take the kids to school, and yeah, I still have that don't talk to me, I haven't had my coffee moment, but at the same time, I'm not dragging, if you know what I mean. I'm not feeling like, ugh, I need to go back to bed. I should have hit the snooze button. I'm actually like, hit the alarm, turn it off, get out of bed. I'm not laying there feeling like I could sleep all day. So now come 2 o'clock in the afternoon, I start to get worn out. That's of course why I have my coffee, but I'm not as tired and I don't have as big of a headache as I usually do. Now I do get headaches. They are excruciating. I had one all day yesterday, but it wasn't a debilitating headache. There were times where I would get headaches so bad that even one point I had to go to the doctor because I thought I had West Nile because of the symptoms I had. Plus, sorry, I have a dog underneath me who wants all the attention. Plus, I had to go and get migraine medication. And there was a time where I just had to lay on the couch or lay in bed with an eye mask over my eyes, the light turned off, the curtains closed, could not have any noise at all. Now there are times where I still get like that, but not as often. And I actually find that also when I work out, I feel like I'm in a better mood. It does help your mood. I feel like it's a stress, anxiety reliever. And with lupus as well as fibromyalgia, I had actually been diagnosed with medically induced or illness-induced anxiety and depression, which means that with my illness, I developed those other two illnesses as well, because I began to worry a lot. I began to panic a lot of, oh, this is happening to me, and what if it attacks my organs and I pass away and I don't get to see my kids grow up? What are my kids going to do without me? What is my husband going to do without me? Who's going to clean the house? Who's going to cook dinner? A lot of that. And then, of course, I became to the point of being really depressed because I would have to call into work. And, of course, they were not always believing that I had this illness or thinking I was always making excuses. And then I'd lose friends because I would have to cancel events or cancel outings, and it became very depressing. So I feel with working out, I actually feel better, more energized, happier. There are times where if I get into a disagreement with my husband, I'm like, oh, I haven't worked out today. Let me go ahead and work out and work off that stress, work off those emotions. If I had a fight with a friend, then I would work out and I would actually do more high intense, like boxing moves, and pretend I'm punching the person and kicking the person, and it felt better. It did. It made my mood skyrocket and it felt better. So I have the TV on, so I apologize for any squealing sounds or whatever. It's trying to keep noise going so I can do this video while the baby sleeps. Now, there are 3 main types of exercising that people with lupus should include in our routine. It's strengthening, anything dealing with range of motion, so, like resistant bands, anything that keeps you moving and would further your range of motion pretty much. I do a lot of resistance band training. I do a lot with weights and work exercising with those dumbbells, and I do a lot of rows, a lot of flies to get my shoulders going and keep them from being stiff, so that way I have more range of motion in my arms. I love leg days. I will do leg days every day, all day long. It for me, I feel like it stretches out my legs, stretches out my muscles, and I'm actually, I can do more things. So definitely range of motion, resistance training, strengthening, which again helps with the resistance bands and the dumbbells or weights. I also have the loop bands, so that definitely helps. And then, of course, endurance, any cardio. So that really helps. And, of course, I have asthma as well, so I really have to watch that cardio. And so I do wear, I'm not wearing it right now, but I do wear a watch that, rates or monitors my heart rate. And when I really feel like I'm about to collapse on the floor, I definitely take a look at that. And I feel like if that heart rate is way too high, I definitely take a break. I pause, take a 30-second to a minute break, and then I get right back to it. So definitely those are the 3 that if somebody with lupus, has, it's definitely good to do. So, let's see, what else? Now during flare days, when I'm in a flare, Here goes my computer. When I'm in a flare, do I work out? Not usually. Why? Because I can't get moving. If it hurts to get out of bed or hurts to walk, I don't do anything. I don't want to push myself because then that will further injure me or keep me in a flare longer. Now, if I'm really wanting to work out to better my mood or to be energized and I am in a flare, I actually do some stretching, some yoga, some Pilates, some bar movement, whatever gets me stretched. So it raises my heart rate. I do that for 10 to 15 minutes as long as I can, but it's also easy. It's easy on my body. I'm not pushing myself with yoga. I'm not pushing myself with Pilates. I am actually stretching those muscles and actually rebuilding those muscles. So what I would say for anyone with lupus that is inspired by my workouts, my progress, anyone with fibro that is inspired by my progress or motivated by it, I would definitely say first discuss it with your doctor. I did not do that, but I actually, I've discussed it in the past with him, but it's also one of those where I used to be active all the time when I was young. Even active with my kids. And so I definitely did not want to just be sitting around on the couch doing nothing or laying in bed all day. So I definitely did a lot of research before I started this. But definitely discuss with your doctor. If not, do a lot of research. I would definitely say that. Start out slow. Start out with what you feel like you can do. Like I said, I did push-ups, planks, squats, and sit-ups. That's all I did. Those 4 exercises. I believe it was just 4. I think I did it 3 times a day, which equaled out to about 15 to 20 minutes. I did not do it all at once. So I did like 5 minutes here, 5 minutes there, and 5 minutes there. And at the end of the day, I already did my 15-minute workout. If you are sore, apply heat. I would definitely suggest that. Epsom salt baths, and stretch and rebuild those muscles. But definitely, if you are sore, do not push yourself. There have been days where I feel like I can't move my arms because I just did a bunch of push-ups the day before. And what do? I work out the next day, and lo and behold, there's more upper body. And the following day, I'm to the point where I literally cannot even pick up my baby. I cannot wash a dish because just any movement of my arms hurt. So definitely do not push yourself. Do not push yourself. I will repeat that. I have learned over the last 2 years that I have to listen to my body. Definitely stretch before and after your workouts. It doesn't matter what you're doing. Now, yoga, you're already stretching. Pilates, you're already doing some stretching. But definitely stretch before and after your workouts. So if your workout is 15 minutes long, or you're watching a YouTube video and working out, or you're doing this workout with a couple friends, definitely spend at least 5 minutes stretching before and another 5 minutes stretching afterwards. So then you've pushed your workout to about 25 minutes. Start slow and then gradually work up to small weights, resistance bands, machines. If you go to the gym, definitely start out slow. I did small little workouts here and there, and then I said, you know what, let me get some resistance bands. Let me try that. Once I felt like I had it down with resistance bands, I ended up getting some dumbbells. They're only 5 pounds each, which total 10 pounds that I'm lifting. There are times where I lift the baby, who is 17 pounds, something like that, 18 pounds. So, and then of course I got the loop bands, which are different strengths, and I'll use whichever one depending on how I feel that day. I may use the strongest maximum one, I may use the weakest one. It depends on how I feel. I also got the ankle and Wrist weights, to add weights to it, those are only about a pound each. So again, not adding too much weight, but I'm adding that extra weight. If you're sore afterwards, definitely use an ice pack. Apply ice, apply heat. So kind of go back and forth. Add that yoga stretching in there. If you have to, don't even do the workout. Just go take a short walk if you want to. If you have dogs, take the dogs out for a walk. Take the kids out for a walk. Let them play. But definitely, if you are in a flare and feel like you can't even get out of bed, do not push yourself. Just don't do it. I've got notes so that way I don't stumble upon all my trip over my tongue and stumble too much. Now, if you work out too much, which there have been times where I did 7 days a week. Now, at least 2 of those were yoga, but I still did. There were times where I did yoga and I was sweating. So, definitely felt it afterwards. There was extreme fatigue. I felt very tired and didn't want to move, didn't want to even cook dinner, didn't want to change a diaper, didn't want to do anything. I felt very weak. There was a decrease in my range of motion where I couldn't even move my neck, I couldn't move my arms, I could barely move my legs. I felt like my fingers were swollen, my toes were swollen, my knees were swollen, everything felt swollen, and I was in a lot of pain. So then I really had to listen to my body and say, you know what, it's too much. We need to back off a little bit. And of course that would be a flare. That's pretty much what a flare would be after a workout. So it's one of those where during a flare, if say it's just my knee that hurts, I'm not going to do a bunch of squats. I'm not going to do anything involving bending that knee. I will do a different workout. So if it requires squats for the day, I'm going to look up an alternative to squats where I don't have to bend that knee. If my shoulders are sore, I will not do any upper body dealing with that motion of my shoulders, and so forth. So just kind of modify. I tell a lot of people, modify. If you can't do something, modify it. Work your way up to where you can do it. If you can't do it because you're sore, definitely look up alternatives. Do not push yourself to do that certain exercise. Your body is not going to let you do it. I'm sorry. If you try to do a squat and your knee is swollen, you know what's going to happen? You're either going to cry in a lot of pain, you're going to wince and be like, ow, and then you're just going to give up. So don't do it. Your body is going to tell you, not happening, not today, so do something else. Definitely modify. And if anything, stop what you're doing. If your chest is tight, if you're feeling dizzy, if you're out of breath, if you feel sick to your stomach, definitely stop right away and take a break. So all in all, that is me working out with lupus and fibromyalgia. And that's my advice. If you have a chronic illness that affects your muscles and joints and bones, definitely start out slow, work your way up. Again, I am 6 months into this now, 5.5 to 6 months into this, and there's still a lot of stuff I have to do to modify. And I don't plan on training to be a bodybuilder. I don't plan on trying to work out enough and exercise enough to get down to 120 pounds. I just want to be toned up. I want to be healthy. And I tell a lot of people all the time who say, hey, you make a great coach. Great, that's fine. But I'm doing this for me. I'm doing this to make my life healthier, myself healthier, and to live longer so I can see my kids grow up. And I feel like it's helped. At least the last doctor's appointment I had, I don't know if I was in remission, but I did have a lot lower numbers. My levels were low. So I feel like it's helping. And, it could help you too. But just listen to your body and do, small little workouts here and there and see what you can do. And don't feel bad if you can't. Take walks, 10-minute walk every day, 10-minute walk every other day. Try to get in at least 2,000 to 3,000 steps a day. I maybe get, even working out and being busy with kids, I still only get about 5,000 to 6,000 steps a day. Whereas people are like, oh, get 10,000. I would never sit down if I was to get to 10,000. If I had a job that was constantly up on my feet, maybe I would get to 10,000. But as a stay-at-home mom, I'm lucky to get to 5,000. So, and that's my goal. Every day is 5,000. So definitely that's my life with working out while having lupus and fibro. And if you have any other questions about those illnesses or about working out with those illnesses, definitely don't hesitate to leave a comment or a question or send me a message and let me know.